We have our next and final venture of the day on the main stage from our CDL cancer stream. And I have the great honor of just telling you a bit about our CDL cancer stream, which this is our very first year of doing this stream with the Canadian Cancer Society. So it's a very visionary partnership. Canadian Cancer Society is the largest charity dedicated to stimulating cancer research and supporting prevention, survivorship, treatments, and diagnostics, all related to cancer. They're an incredible organization and worked together with us to develop a truly remarkable experience for the year. They recently released their annual Canadian Cancer Statistics Report. And you can see the numbers on the slide here, but I think the headline says it all, which the WHO reports projecting a 77% increase in global cancer burden by 2050, growing from 20 million cases in 2022 up to 35 million cases by 2050 per year. And so one of the really unique features of this stream, which we've never had in any other stream we've run before, is we had a person in the room as a patient advocate. So we had a patient advocate mentor, and I'm going to introduce you to her now, and I'd invite her to say a few words about her experience this year. So Robby Spring is an experienced professional in health innovation, commercialization, and public affairs, holding master's degrees in both neuroscience and translational research. Robby has over 15 years of experience across academia, hospital, government, and industry in the health and life sciences sector. So please join me in welcoming Robby to the stage.
Thanks, Sonia. 3 women, 2 generations, 1 diagnosis. 3, 2, and 1. My name is Robby Spring, and I'm a breast cancer survivor. And so is my mom, and so is my sister. With no known genetic variants, my cancer was only found because my sister had it a few months before me, and my sister's cancer was found because our mom had it a few years before her. This shared experience completely reshaped our lives, tested our strength, and gave me a crash course in Canadian oncology and its gaps. As Sonia mentioned, I have 2 master's degrees, one in neuroscience and the other in translational research. Having worked across industry, academia, hospital, and government, being an oncology patient and care partner completely reshaped my view of our healthcare system. I feel like I have this 360-degree view now. I obsessed about my cancer treatment plan like I obsessed about my master's thesis or a big project at work. But in this case, the stakes weren't pass or fail or a year-end bonus. These were life and death decisions that I was making at every step of the way. However, my ability to make these decisions often didn't come from my care team or the system, who presented me with really limited and non-specific data. They came from the other patients that I met along the way who were faced with the exact same decisions. Each step in my care plan was like a choose your own adventure with implications at the next inflection point. Earlier access to precision oncology tools could have changed our entire care pathway. For example, my sister and I were both told originally that we had a non-aggressive form of breast cancer, when in fact it was highly aggressive. This led to my sister making a surgical decision to get a lumpectomy when she actually needed a mastectomy, and the cancer ended up in her lymph nodes. In my case, I was made to wait 11 weeks from the time I was first diagnosed to the time that I received my first line of treatment, which was way too long. In Canada, we have a desperate need for oncology solutions that are tailored to the patient, that are cost-effective, and can be scaled into care pathways. The Canadian Cancer Society's collaboration with CDL is innovative and amazing, and has the potential to impact the 2 in 5 Canadians that will be diagnosed with cancer in their lifetime. and this can't come at a moment too soon. Unfortunately, our family's cancer journey continues, as my dad was just diagnosed with prostate cancer. Over the last year, what I've learned is that patients provide immense value to the healthcare system, to innovation processes, to policymakers, and to organizations. These interactions are a two-way street. Your innovations help the patient, but the patient in turn can help you innovate. My experience with CDL has shown me that there's a great need for patient engagement in early stage innovation and in the investment process to help assess feasibility and impact. As I now return to my career with this new perspective, I'm working with companies and organizations to help integrate the patient voice and to create meaningful opportunity for patient engagement in order to advance health and life science innovation and policy. By sharing my story, I aim to inspire others to take charge of their health, to become active participants in their healthcare, and to improve access to innovative oncology solutions. Enough with the 3, 2, 1. Let's aim for 0. Thank you.
And now I can't think of a better way to close our venture showcase today but introducing Peter Liu from Oxford Cancer Analytics. This venture has developed a liquid biopsy blood test technology for earlier cancer detection. Having created the largest biobank of its kind across 10 hospitals and over 3 continents, OxCan has been able to demonstrate a more than doubling of early-stage cancer detection compared to other technologies, and its technology has broken the record for the endogenous number of proteins detected in the blood, which everyone here knows is 5,792. So please join me in welcoming Peter to the stage.
Thank you very much, Sonia, for that very kind introduction. Good afternoon, everyone. My name is Peter Liu. I am a medical doctor and a scientist by background, having focused on cancer research and innovation for the past 12 years, and CEO of Oxford Cancer Analytics. The problem is that the deadliest cancers are often diagnosed too late. 1 in 3 people in the world will be diagnosed with cancer. Unfortunately, that's too many of us here in this room. And current detection methods, unfortunately, detect about 50% of these at the late stage. In fact, all of these patients at the late stage are terminal, leading to death, and treating late-stage cancer costs over 3 times the amount compared to early stage. Therefore, not only does late detection cost lives, but also money. Our solution is liquid biopsy, a simple blood test that's able to pick up materials in blood predictive of cancer in a safe, inexpensive, and routine manner. Whereas the majority of competition has been focusing on DNA, which had limited potential in terms of detecting cancers that can really be saved and resulting in these deaths, we were able to double to triple sensitivity across 8 different types of cancers compared to a leading competitor using state-of-the-art proteomics and machine learning. And the final product costs only up to 1/10 the amount, deployable in any diagnostics facility with no additional infrastructure or training requirements. Our initial focus is on lung cancer, simply because it is by far the biggest unmet need in cancer mortality, killing the most number of people out of all cancers. There are over 460 million people at risk of lung cancer, and that's a huge market. That's a $230 billion market. To put this into context, about 80% of these cancer patients are diagnosed at the late stage for lung, usually with less than 1 year to survive. With early detection, we're able to offer curative treatments to these patients. And that's why we're able to deploy our test on one of the largest studies of its kind with over 600 patients. And we were able to detect early stage lung cancer with 80 to 90% sensitivity and specificity. That's about double to tripling compared to a leading competitor at just 40 to 20% sensitivity. And this was how we started CDL. What did we do during CDL? we were able to scale and imminently launch our product across 3 different market segments, starting from research as a service, deploying our cancer detection product by next year, and finally with further test kit detection deployment with regulatory approval. We're currently working with leading academic institutions and some of the largest diagnostic networks worldwide to deploy this product. And we also got an ISO 13485 certification and currently in the process of filing for FDA breakthrough status application. We expect to help over 100,000 people by 2028, expecting an exponentially growing ARR of almost 60 million by 2028. And we're only getting started. So what's the secret? Well, here it is. Before, we were able to see the blood proteome at a 64-bit resolution, like what you see with the Mona Lisa here. With state-of-art proteomics and machine learning, we see this at 8K resolution for the first time, giving us unprecedented insight on how we can best detect and treat these diseases. We are able to detect over thousands of proteins in the blood endogenously for the first time, and then we have a tailored machine learning algorithm that distills these biomarkers into a focus panel of just 10 to 20 clinically actionable biomarkers. Now, these are very cutting-edge technology that we own IP to, but the final product is extremely inexpensive and deployed on existing platforms that is scalable in any diagnostic facility worldwide. And lung cancer is only the beginning. We're currently working in parallel so that we can detect the most prevalent and deadliest cancers with a single test, in addition, moving in parallel to cardiovascular disease, neurodegenerative disease, and autoimmune disease. The vision is to be able to impact billions of lives worldwide by fundamentally transforming the way we detect diseases and personalize medicine. Our team is made of world-class experts with expertise transcending oncology, machine learning, regulatory affairs, market access, and business, with experiences stemming from Nobel-winning groups, Oxford, World Health Organization, and more. We'd be here all day if I mentioned all the world-class and wonderful collaborators and advisors we have, but notably, our chairman is Brad Wilson, former president Europe of GSK, who led multi-billion-dollar pipelines for commercialization. So throughout the CDL journey, we started a Series A along with CDL, and now we have more than $10 million SOCRO for the Series A, co-led by expert and international diagnostic and impact VCs. We're closing the round, but because CDL has been instrumental in this journey, we have left a special opportunity just for the CDL community to join the round. And even if you are not a part of this round for Series A, having some trouble with the clicker here. Here's how you can help transform life with OxCan. Well, first of all, ask your doctors about cancer screening and see if you're eligible, and then remind those around you as well. Second, get in touch. If you want to see OxCan's life-saving product in the hands of you, your family, and friends, please help us link us to primary cancer care centers, diagnostic networks. These are the Quest of the US and DanaCare for Canada. And finally, we're hiring, and see if you want to join this world-class team so we can transform lives together. Together, let's impact billions of lives worldwide and fundamentally transform the way we detect diseases for early detection and personalized medicine. Thank you, everyone.